Welcome and thank you for joining us today for the first workshop of the Coalition of Action for Healthy Diets from Sustainable Food Systems. My name is Francesco Branca. I'm the Director of the Department of Nutrition and Food Safety in the World Health Organization. I'm happy to welcome you on behalf of the convener, WHO, FAO, and the conveners of the coalition. I'd like with a few housekeeping notes. We will be recording today's session, and I encourage you to use the chat, the Q&A function, to submit comments, questions, and links throughout the workshop to contribute to today's discussion. Let me start by saying a few words about the coalition. The purpose, the vision of the coalition is to align, mobilize, and support collective action towards a shared vision of a world where all people are eating healthy diets from sustainable food systems. The Coalition of Action for Healthy Diets from Sustainable Food System intends to perform three functions. The first is to mobilize and coordinate existing expertise and stakeholders to align action across food systems for collective impact at the country level. Second is to facilitate peer-to-peer learning between countries. And third is to manage special projects that integrate nutrition, health, and sustainability through food, determined by country priorities. Assessing and monitoring the quality of the diet and its sustainability is clearly a key element. Your attendance here today reflects your interest in this vital topic, which was identified as a priority area for peer-to-peer learning through discussion with our member states, as well as analysis of their published food system pathways. Robust indicators are vital to achieving this vision, from defining concepts, monitoring trends and progress, to driving forward evidence-based policy action. Effective indicators act as an essential guide and as a crucial accountability mechanism to drive forward transformative action. All countries have active monitoring systems to assess diet, nutrition, and food system indicators, with a growing number incorporating measures of environmental sustainability. Many of the core group members of the coalition are also active in this area, creating global and country-level initiatives to monitor aspects of healthy diets and sustainable food system. There's much work to be done to align, mobilize, and support action. And we need to capture the complexity of defining elements of the concept behind healthy diet and sustainable food system. But they need to be brought together in a way that they would support universally agreed indicators and translate into practical action. Today's workshop will aim at creating really a space to share reflection with member states and the academic groups that are working on this topic on the opportunities and challenges to use healthy diet data. So we aim to reflect on the concept of a healthy diet and review the various aspects of food consumption that this encompasses, and the extent to which this does already or could reflect aspects of food system sustainability. We would then learn from member states on the opportunities and challenges for the collection and utilization of indicators of healthy diet from sustainable food system for policy making in their context. We would like to consolidate lessons from country experience that can inform ongoing efforts to improve healthy diet indicators and see how this could help inform efforts in sustainable food system. We hope this workshop will be the beginning of a productive workstream of indicators for healthy diets from sustainable food system under the coalition work plan. Also in dialogue with an initiative that FAO, WHO, and UNICEF are leading on the development of really a good set of effective indicators. We will be developing key messages and next steps in a document based on today's discussion, and will circulate to all of you. But before we dwell in the discussion, I would like to run a poll to get your initial thoughts on what is the single most important barrier to the collection of data on dietary intake and quality in the context where you work. you should be now seeing the options on your screen, which include lack of funding, lack of technical capacity, lack of perceived need, lack of clear guidance, or instead you can say that you don't believe there are major barriers. So let's see what you're responding to that. I should be able to see the replies there as soon as they come. I really must thank Jessica, particularly who's organizing the seminar. So I'll be guided by her to see when we have the. Okay, so Jessica is analyzing the data. Most common reply: lack of funding. So that's really the challenge you see. Good. Okay, so thanks for this, and let's start our webinar by having an introductory presentation by Dr. Ed Frongio, who will help set the scene for today's discussion by exploring how we can capture the essence of a healthy diet. And meanwhile, you can see, okay, the results of the poll. Dr. Frongio is a professor and director of global health initiatives at the Arnold School of Public Health at the University of South Carolina. He has expertise in validation of measures, policy and program evaluation, and design and analysis of longitudinal and evaluation studies, and is a valid member of the Technical Expert Advisory Group on Nutrition Monitoring that is convened by WHO and UNICEF. So Ed, the floor is yours. Thank you.
Okay, hello everybody. Jesse, is this the right thing?
Yes, looking good.
Okay, all right. Thank you for inviting me to participate. So what I was asked to do, as Francesco said, is to talk about capturing the essence of a healthy diet and implications for indicating and data collection systems. I want to start off saying something about the overall challenge, which is to, first of all, come to some consensus about methods, measures, and indicators. We'll talk about what those mean that are best suited for assessment, global assessment and monitoring, including monitoring in countries, have measures and indicators that are collected in data systems, and then ensure that these are used by countries, but also adopted for these SDGs and other the World Health Assembly commitments and others. So what do we mean by essence? I like this word that was proposed for this. So the technical way we think about it is through the idea of a construct. So when we think about the essence of something, in this case, the essence of healthy diets, we try to think about then healthy diet is a construct. It's something that is a phenomenon of theoretical interest to us. It's something that's real. It's out there. We think we understand that some diets can be healthy and some are less so. But a construct is also an abstraction. It's in our minds, and it's a way that we invent, in a sense, to describe the phenomenon. And it can be observable or unobservable. In the case of healthy diets, theoretically, it's observable. We could follow our teenager around all day long and see what they eat, and determine to the extent to which that's healthy, and do that day after day. But that's not very practical. And in country survey systems, it's not very practical to observe it directly. So we often have to rely on reports from people about what they've eaten. So a measure is in a very technical sense, is simply a way of assigning numbers to people, in this case, that represents relationships that exist among those people with respect to some specific construct. So we're interested here in differentiating individuals or households in terms of the healthfulness of diets. And the idea is that that number represents the relative amounts of whatever that construct is. And it's important to remember that measures always pertain to the construct of somebody, not to the person themselves. So we measure many different aspects or constructs on someone theoretically. So what's the relationship between these two? Well, in the literature, we can think of two different ways, and this is used, both ways are used. One is what's called a reflective measure, the idea that the construct dictates what the measure should be. So we first determine what it is that we care about, the part of the phenomenon that we care about, and then we use that to then drive what the measure should be. And so the measure then represents a reflection or manifestation of the construct. And this is the basis for classical measurement theory, for example. The alternative is what's called a formative measure, where the measure, in some sense, leads to the construct. So the construct is informed or induced by the measures. And oftentimes, this will be a composite of a bunch of variables. So for example, socioeconomic status, which is debatable whether it's really strictly a construct or not, is something we commonly use, and we usually mix together information about occupation, education, and income in some way, and then we declare it to be socioeconomic status. So we'll come back to these two ideas in a bit. An indicator is something that we typically derive from measures of the phenomenon and for the purpose of demonstrating something about it. And so having an indicator implies understanding what's better or what's worse. So for example, in the SDGs or in other targeting systems like that, we want to be able to have an indicator that tells us what proportion, for example, of the population are on track for that particular goal. So here's how these ideas could come together. So let's think about a construct of nutrition adequacy. So how would we get information about this? Well, currently, for example, we could use a demographic and health survey being done in a country. That's the data collection system. That data collection system uses a method or an instrument, which is a questionnaire. The questionnaire puts questions, obviously, to respondents. From those answers, from those responses, we get a measure, which in this case might be food group diversity. And then from that, we have an indicator, which is whether people have met the minimum dietary diversity or not. And what we hope is that this measure and indicator together will lead to interpretation and action that, in this case, to take an example, might promote the consumption of animal source foods in infants and young children, to take an example. All right, so that's how these ideas fit together. So, well, what makes something interpretable and actionable? Well, we want measures and indicators to be valid. That means that they're suitable for providing useful analytic measure for a given purpose and context in your country for the reasons you need to have it. And that boils down to that it's based on understanding of the phenomena we care about, that it's reliable, repeatable, and that it's accurate, that when things really change, that it picks up those changes. We want it to be comparable across contexts. We want it to be relevant to the purpose and context. We want it to be feasible in terms of costs and credible, that when we report it, that other people are going to believe it and act on it. So one question we confront is, do we want a reflective of a form or a formative measure? So let me give a couple of examples to illustrate the difference. So the first one is UNICEF has led an effort. It's the second effort to have an early childhood development index. And so this is a graph taken from one of their brochures. So this was put out in 2020. I was on the technical advisory group for this, and so followed along. So this relates to the SDG indicator 421, and the target there is early childhood development and early learning opportunities. And so what the development group did was first think through, okay, what are the constructs? And here they use the term domain, but it means the same thing. So there were three constructs: learning, health, and psychosocial well-being were the three constructs. And then those were divided into subconstructs. So there were 12 subconstructs that you can see. Under learning was expressive language and numeracy, literacy, et cetera. Under health, self-care, gross and fine motor skills, et cetera. So there were three constructs, 12 subconstructs. And in the end, they selected from a larger set of items that they tested, 20 items in a questionnaire that would get at this set of constructs and subconstructs. So this is an example of a reflective measure where first the thinking was done about what was needed, and then the measures that were developed to reflect that. A formative measure is one that's more like this. This is pictures of my wife making one of my favorite foods, pea soup. And the idea of pea soup is that the ingredients don't have to be the same every time in every place. You take whatever ingredients you have and then you mix them together in some way. So there's some method that you use to bring this information together. And then after that, you end up with the product, which in this case is pea soup, but otherwise would be some measure that then we could then declare to be pea soup, sort of regardless of what's in it. If you start off making pea soup, you're going to end up with pea soup regardless of what you actually put in it. And it's the same for socioeconomic status, that we take, for example, a set of assets that people have that we think reflect wealth, that people who have more assets have more wealth. And then we mix those assets together in some way, and then we end up with some kind of scale that reflects that. And that doesn't have to be the same from one place to another in this system. And so I'm illustrating this because it's really important in this case that we develop reflective measures and not formative measures. So what constructs and subconstructs are important and feasible to measure? So some questions that come up about, we're talking about healthy diets or healthfulness of diets. There's that term, that idea out there, or this diet quality. What do we mean by these? What are the important constructs and subconstructs that should be and can be measured? Some of the ideas out in the literature that people have promoted are nutrition adequacy, focusing on ultra-processed foods, on classifying foods as healthy or unhealthy, focusing on whether foods protect against diet-related non-communicable diseases. But then there's other considerations. For example, particularly relevant to this workshop is the idea of food system sustainability. Is that an important construct or subconstruct to healthy diets or not? What about social and cultural preferences? And there's a number of others that we might think about as to whether or not they should be included. So there's some work that I'm part of that's funded by the U.S. Department of Agriculture, because the United States is grappling with these issues and wants to be able to add into its monitoring system a way of assessing and monitoring healthy diets. And so one of the things we were tasked with doing was determining what might be the subconstructs of the construct of healthy diets. So this is proposed and has been sent around last week, actually, to lots of people for input. But in our review and analysis, we came up with 7 that healthy diets are adequate for nutrients, relative requirements, without having excess amounts of nutrients, nutrient dense, balanced, diverse, moderate in intake of components that are associated with detrimental health, that they're safe, and that they're in patterns associated with positive health. So we'll have lots of discussion about this, but it's really important as a global community, we come together around some consensus about what these subconstructs should be, so that when we talk about the construct of healthy diet, we're being consistent. Another question is, what are the purposes for which we want to use this? And this is where this workshop is particularly important, because there's lots of people in the workshop who have experience in their country and about what they're trying to do. But in general, sort of generically, we could be trying to estimate prevalence and what's the situation now. Monitoring is how's the situation changing. Going down near the bottom, another population purpose one could imagine easily for healthy diets, measures of healthy diets, are targeting what places are things worse than others and maybe need to have action directed there. But then there's some other purposes listed. There's also some purposes at the individual or household level, but we won't consider those right at the moment. Okay, but we'll have to think through what are these purposes. And then if we want to monitor, for example, exactly what are the questions that we need to have answered when we're monitoring. So monitoring is just a category, it doesn't really tell us the exact purpose. So if measures we develop about healthy diets are going to be useful and acceptable, then some of the issues that might come up is it credible and transparent, interpretable and actionable, are the data going to be accessible? Can we collect the data? Is scalable to the levels that we need? For example, if we need it at the level of provinces, can we collect data at that level? Can it be implemented in multiple data collection systems so that we can make use of existing systems? What about composite measures? Do we bring some different measures together and make some scale or composite? And what about modeling? Is there a place for filling in data gaps from modeling? We've started to do this in the last few years for anthropometric assessment of children, for example, to help countries have an estimate of where they are, even if they haven't collected data in a particular year. So those are some of the questions that come up. And then there's questions about harmonization. Thankfully, there are some scientists and collaborators that have been developing measures aimed at trying to assess healthy diets, and so we have some starting points. I'm sure that we're also going to identify some gaps, but when there's multiple measures out there, do we merge measures together if they're similar? Do we continue with multiple measures that are similar but choose one for a given purpose? For example, for food insecurity, we have measures, multiple measures of food insecurity, about 4 or 5 that are being used globally, but the Food and Agriculture Organization settled on one that they helped develop, that they did develop, and then that was accepted for use for SDG monitoring. Or do we have a suite of measures and with different subconstructs, strengths, features, and purposes, and let countries decide, what makes sense in their particular context? So there's a set of harmonization issues that will come up. So I'm going to stop there. This was meant to help us start to think about during the workshop the essence of how do we capture the essence of healthy diets, and to just, in summary, what I've tried to suggest is that we need to think about this in the sense of developing reflective measures, which means first really thinking through what is the essence of healthy diets. In other words, what are those constructs and subconstructs? And then from that, try to make sure that we have measures to the extent possible that tap into or reflect those. And then there's a set of questions we'll have to deal with as a global community to come to consensus about how collectively together we're going to do this that helps each country, but also helps us globally get a picture that we can monitor over time. So I'll stop there. Thank you.
Ed, thank you very much. That was extremely helpful. And I think you're basically highlighting what should be our thinking process to develop these measures. And I've seen in the chat some questions about, what about the existing metrics? I think that at some point will come, but we'll basically starting from really identifying, the reason to do that, and what are the reference elements we want to have from the theoretical and the practical point of view, because Ed also mentioned a number of practical points about the feasibility of collecting and interpreting the data. We're not going to have a Q&A with Ed just now, so please hold your question or place them in the Q&A space. We're moving now into a brief section where we're hearing country reflections. We're hearing particularly from the members of the group of the Healthy Diet from Food System, Sustainable Food System Coalition, which have come forward. So we call them the front runner countries, on their experiences with using diet quality and intake data to inform policy and programmatic action, how they consider the incorporation of environment, economic, socio-cultural elements. And I think we're having a recorded message from Brazil first.
Hello, I'm Gisele Bortolini. I'm a public servant and I am the coordinator of the Nutrition Food Policy here in Brazil and the Ministry of Health. I'd like to thank for this invitation to share our experience. The Brazilian Food and Nutrition Policy have historically been evidence-based as well as the national guidelines for the promotions of adequate and healthy diets present in the dietary guidelines for the Brazilian population and the dietary guidelines for the Brazilian children under 2 years of age. The use of national representative dietary data from the national representative surveys and from the data of the populations attended in primary health care are important for us for policy formulations, policy revisions, for monitoring and evaluations, the food and nutrition programs. And this topic is addressed in the global report on the state of dietary data published by Food and Agriculture recently. For example, the revisions of the national dietary guidelines was based on the identifications of health foods pattern reported in the quantitative 24 hours dietary recall informations collected in the National Family Budget surveys, that in Portuguese is Pesquisa de Orçamentos Familiares, that allowed for us development or dietary recommendations based on the Brazilian consumptions. The data from the data of the National Family Budget Servers, Pesquisa de Orçamentos Familiares, also was used to inform and review several food regulations and reformulations actions and policies. Sodium and sugar reductions initiatives based on the reformulations of processed and ultra-processed food have used POF, Pesquisa de Orçamentos Familiares, to determine the priority food categories for reformulations according to their contributions to nutrient intake here in Brazil. The revisions of the mandatory flour fortifications used also the survey data to justify the selections of appropriate foods, that here is maize and wheat flour for fortifications, as well as foreseeing of appropriate, foreseeing safe lower and upper limits for iron and folic acid fortification levels. Another example is that the national micronutrient supplementation programs were revised recently based on recently data of micronutrient deficiency from the National Survey of Child and Nutrition conducted recently. The survey analyzed data on nutritional status, food consumptions, and nutritional deficiency of children under 5 years in Brazil. The programs are reviewed using these new informations. Finally, we also use data from the evaluations of the nutritional status and food consumptions markers of the populations in primary health care. These data are consolidated in the Food and Nutritional Surveillance Systems, our SISVA, and last year, partial results show that we had about 33 million individuals with an assessment of nutritional status and about 2.4 million individuals with an assessment of food consumptions. Based on this data, Brazilian cities can monitor the food and nutritional conditions of the in the local level and organize the nutritional care in our unified health systems, or SUS. And it is also possible for local health professionals to guide the populations at all stages of the life course on adequate and healthy eatings. Among the main challenges we can mention that this is the maintenance of the periodicity of the national service and the encouragement of using of the data by the health sector and also by other sectors such as education, agriculture, and assistance in order to guide actions related to the population's food and nutrition conditions. The use of dietary data is extremely helpful to improve decisions making and greater cost effectiveness in the actions related to promotions of health diets, preventions of negative diet-related outcomes, and micronutrients deficiencies. Thank you.
Thank you very much to Brazil for this experience. I think the good message there is data are collected through surveys, through the primary care systems, and you can see that they're used really for policy making, for even direct advice to the patients. So we have definitely a very important starting point in the experience of Brazil. And it's now my pleasure to have with us Annika Sjöström in person, General Director of the Swedish National Food Agency, to share insights from Sweden. Over to you, Annika.
Thank you. I will just try to share my screen. Now, can you see it?
Yes, we can. Thank you.
Good. Thank you. And good afternoon, everybody. And thanks for giving me the opportunity to tell you about an ongoing work in Sweden with goals, indicators, and measures for a healthy and sustainable food consumption in Sweden. The Swedish Food Agency and the Public Health Agency of Sweden, we have been giving a government assignment that entails preparing a suggestion for goals, indicators, and input areas that will create a direction for working towards a sustainable and healthy food consumption in Sweden. So these goals, they will cover food consumption and also aspects of the food environment. Socioeconomic differences and the situation for children are important perspectives that will be integrated in the goals and in the indicators. Food really has the potential to change both people's health and the well-being of our planet, and we can't fix the 1.5-degree goal unless we fix the food system, and we can't improve our health and the well-being of the people without a healthier diet. And in order to transform the way we consume food, the entire society really needs to be able to work towards a sustainable, healthy food consumption. And we need to be able to follow the progress of this change, because you cannot improve what you cannot measure. So therefore, the background to this task given by the government to our two national authorities was that if we have bold goals and indicators for a healthy and sustainable food consumption in Sweden, those goals could leverage the necessary changes of food consumption.
Annika,
yes?
I'm sorry, are you still showing only the title slide, or are you moving your slides?
No, I'm not moving yet. I just have 3 slides. So.
Okay, thank you. Okay, just to check, thank you.
I'm still in the background. Yeah, good, thanks. So the idea is that these goals and indicators could leverage the necessary changes for food consumption. And the idea is also that national, regional, and local level, as well as the public and private sector, could work towards the same goals and concentrate their efforts towards the same goals. And by that, we could also see more effects. And also by having indicators, good indicators, we could also be able to follow the progress and see where more efforts are needed. So now I will move to the next slide. Oh, that was not easy. Nothing happens. Now I think you see the next slide.
do. Go ahead.
Yeah, good. So this project started a year ago, and it will continue until the beginning of 2024. So today, unfortunately, I can't give you any details about the goals and indicators, but the aim is that we, by January 24, have national goals, indicators, and input areas, and those should be evidence-based. They should focus on the most important changes, which means that they will focus on food environment and also on creating societal conditions for a healthy and sustainable food consumption. They should be usable and easy to implement for public and private sector, and anchored and accepted. And it is very important that the content of the goals and also the areas that the goals cover are based on scientific evidence. So therefore, we collaborate with researchers and different kinds of experts in this work. However, for the goals to be accepted and formulated in a way that make them usable and possible to implement, we have a lot of communication and involvement during this process with stakeholders like decision makers, public servants, food industry, civil society, and also with citizens. So the goals, indicators, and input areas are really co-created with society, improving the quality of the work and the possibility to follow up progress, and also the likelihood of the goals being a successful direction for working towards sustainable and healthy consumption in Sweden. Because the aim is that these national goals will be adapted and implemented also at regional and local level in their public health work and work for a more sustainable society. I think we will most probably have to collect new types of data to be able to follow the progress of these goals. But we are to some extent helped by the fact that in Sweden we have regularly collected self-reported data on food habits in different population groups. And in addition to that, we follow 4 selected indicators for food habits, which are collected via a questionnaire. And those are consumption of vegetables, fruit and berries, fish and seafood, and soft drinks. But also targeting goals covering both health and environment can lead to goal conflicts between health and environment, but also between health, environment, and economic aspects of sustainability. So I think we will need to address these goal conflicts and also see where we actually can find co-benefits. And this is a challenge. So I look forward to, in a couple of years, come back to you and tell the results of this work. And if you want to learn more about it, and if you have more questions about it, you are welcome to contact these 2 persons that are written here on this slide. Thank you very much.
Wonderful. Thank you very much, Annika, and really for having highlighted how this approach is necessary to have common goals, harmonized goals, to monitor progress, and also to consider the different dimensions of health and sustainability. But I'm sure you'll be able to tell us more in the panel, which I would now like to ask my colleague, Lynette Neufeld, the director of the FAO's Food and Nutrition Division, to lead. And so thank you for that. And over to you, Lynette.
Thank you very much, Francesco. And I wonder if my panel participants wouldn't mind turning your cameras on so that we're all here together. The idea of this session is that we spend a little bit more time talking and really trying to have a bit of a conversation about some of the challenges and opportunities for collection and utilization of data indicators for healthy diets from sustainable food systems, and really focusing on their use for policy making and program design across very diverse contexts. So we've already heard some really, really interesting experience from Brazil and Sweden. We're going to come back to those, and you've met our 2 participants from Brazil, who is unfortunately obviously not going to be able to participate in the panel, but you've heard from Sweden. We're going to hear a little bit more. But we're also now joined by Javier Pavard, who is the policy officer with the Directorate General for International Partnership at the European Commission, as well as some global experts. Thank you for joining us. Jessica Fanzo, who is the Bloomberg Distinguished Associate Professor of Global Food and Agricultural Policy and Ethics with the Johns Hopkins University. Corinna Hawk, who is the Director of the City University of London Center for Food Policy. And Anna Herforth, the Senior Research Associate from the Harvard Chan School of Public Health. And we are, of course, also joined by Ed Frangillo, who you've already heard. So I'm going to kick this off with a question to you, Jess, bright and early in the morning over there in the US. So over the years, you've been working together with a number of other institutions and individuals to consolidate data across many areas that are relevant for food systems through the Food Systems Dashboard and the Countdown 2030 initiative. Thinking of the needs of those initiatives, what would be the ideal characteristics of data related to healthy diet from sustainable food systems?
Yeah, it's a great question. And, both initiatives, the Food Systems Dashboard and the Food Systems Countdown Initiative, are large collaborations made up of many experts, including Anna Herforth here and Brent Loken also involved on my screen. We struggle a bit across all domains and outcomes of food systems, be it healthy diets, nutrition, environmental sustainability, livelihoods, social equity. And we struggle on issues of quality of data, coverage of data, and nuance of data. And when we think about diets, it's one thing to capture what people are consuming. And I know Anna can talk about this in intimate detail, and whether or not we are capturing what people are eating. But there's also a lot of gaps on why people make certain choices around diets. What are some of the drivers of those dietary choices, which I know Professor Frangillo works on very, very, very intimately. So we really have these big gaps. And if you were to go to the Food Systems Dashboard and you look at individual behaviors, you'd see that we have really no data there, because that data is not agreed upon. The kind of indicators that we have are not agreed upon, and they're not captured across every country. So we struggle getting beyond just what people are consuming, but why they're consuming certain foods, how those choices are made, what are some of the gaps in the kinds of foods that are available. And this is done, a lot of this is not captured in real time. We're very lagged. And I would say, and I really want to hear from Anna on this as well, a lot of the data that we do have is modeled, estimated data. We don't have really subnational data. So we have a lot of data gaps, but I have to say, and again, I lean on Anna a bit, when we have been working on the Countdown initiative to try to come to consensus on some of the highest quality indicators that we could track over time for accountability, the diet and nutrition space has a lot of indicators to choose from as compared to other domains like livelihoods, like equity across food systems. So the diet and nutrition space has a range of indicators that we can choose from, much more than some of the other outcomes that we want food systems to bring. So we're in a good space in that there's a lot of indicators. It's just which to choose, what are the highest quality, and how can we better capture data that covers some of the gaps that we face around drivers of dietary choice. And I'll stop there.
Perfect. In exactly your 3-minute allotted time. Thank you for that. I'm going to turn next to you, Corinna. You've been providing support to countries related to the dashboard for decision making for food systems transformation. How critical is for thinking about that transformation pathway is the healthy diets from sustainable food system data. And maybe if you wouldn't mind, also pick up on that question that Jessica mentioned, not only the what people are eating, but the questions of why and so forth. If you could comment a little bit about that. And again, 3 minutes, thanks.
Sure, yes, thanks for the question. Can I just check you can hear me okay? So, yeah, I mean, good data, accurate data, and good indicators of that data are really crucial to inform what policies and practices are going to be most effective in driving forward those food systems transformation pathways. As indicated by the remarks of Brazil, it helps that data is essential for helping countries to identify what foods they should be focused on. What are the dietary gaps or excesses in the population, and who in that population is most suffering from that? Is it about inadequate animal source food intake among very young children? Is it about poor dietary diversity among women in certain parts of the country? Is it about high sugar intake amongst adolescents in cities? Exactly what the priority should be can really help focus countries' minds on how to respond to it. And in terms of the why, what this does is once you know really what the dietary indicators and data is telling you, you can say why is that? Is it because affordability is an issue because supply chains aren't properly developed? Is it because the foods are simply not available because it's the hungry season? Is it because actually for reasons on the side of households and people that there are cultural social norms? That means that those foods are not acceptable in that population. So it says, okay, these are the priority foods. These are the foods that we really need to focus on. Why is it that they're not available, affordable, and acceptable in a particular population? That then leads on to a good diagnostic about what the policy response should be. In the dashboard, there were 42 actions which were pulled together from evidence-based reports of things that can be done to drive that shift towards healthier diets. And exactly which one is going to be most useful for driving that particularly identified diet change forward depends on that good dietary data. Is the potential in increased agri-biodiversity with indigenous foods in order to support local markets in rural areas? Is it about taking action in schools of the problems among children? Is it about redirecting fertilizer subsidies away from foods which are contributing, not sufficiently contributing to dietary diversity? So the data underpins all of that. You can't make the smart, right decisions and really focus your efforts without it. Thank you.
Thanks for that. And it's you've added, both of you have added that really critical element of why people eat what they eat, which adds a whole level of data collection, and it's very, very, very important. I'd like to go back to Sweden, to you, Annika. You mentioned to us the experience of Sweden's national goals and indicators that explicitly are linking the healthfulness and the sustainability of the diet, and in those goals and those indicators, which is really great. And you also emphasized in your discussion the co-creation element of the process that has gone up until this point. I'd like you to tell us a little bit about that co-creation process. And if in that process, if you confronted some tensions and trade-offs, and if those arose, and if so, how did you address them? And of course, if they didn't, tell us why you think they didn't arise in the course of that dialogue. Thanks.
I think we are quite used in Sweden to having these type of co-creation processes, actually. So it's not new to us. And of course, there are always tensions between private interests and public interests. That's how it is. And so it's just I think it's very important that those conflicts actually come up and that you really discuss them, and also see how can you help and what can you do to actually come forward with these conflicts, because I mean, business are there to sell. The more they sell, the better they are. I mean, that's the idea of having a business. So how can we, with our goals and our work, also create good businesses? I mean, we have to discuss that as well. Otherwise, we will never see any changes. And so I think if we are very open and frank about that, I think we can also have good discussions and find new solutions together. But it will not be easy, for sure.
Thanks for that. May I follow up on a question, since we have a half a minute left here still? Just coming back to that point that was raised about the what people are eating and why people are eating. Through that consultative process, were you able to get at some of those questions? And if so, did you do that more from a qualitative aspect in terms of the dialogues and the discussions, or does Sweden have data that is informing both on the more quantitative side, both on the what are people eating as well as the drivers that might be underneath that?
I think there is more and more data and evidence now showing that the food environment are really influencing what people are eating. I don't think everybody would agree on that. Some people still think that it's about education and information and informed choices. But I think there are more and more evidence, and also more and more people are now convinced that we have to change the food environment. So in this project that we are currently doing that I told you about, we will have a lot of focus on goals and indicators for the food environment. Yeah.
That's great. That's very helpful, and not something that we've talked. Maybe we'll pick that up again later in some of the further comments down the line. I would like to go now to Anna. Anna, you have been leading the Global Diet Quality Project, which has the goal of collecting diet quality data for global monitoring. Can you tell us a little bit about, sorry, what motivated that project and the specific approach that you're pursuing?
Thanks, Lynette. And yeah, I really appreciate the question. I know you know this very well as having been a core team member of the project previously to your new role at FAO. But it's great to talk with this group about the Global Diet Quality Project, because where we started back in about 2016 with this project was on conversations very much like what Ed introduced. So thanks, Ed, for that. It really was helpful to get on the same page. And we have worked on the Global Diet Quality Project, which is a collaboration between Gallup and Harvard and GAIN, to design a monitoring tool that can be used to scale up diet quality monitoring, which has been something missing. And it's been, the fact that it's been missing is the reason for the existence of the project. Looking through UN flagship report annexes on infant and child feeding and indicators of health and indicators of food security, but not having indicators of diet quality across countries. And having those is really critical to be able to even start answering a lot of the questions that have come up so far in the panel about what's associated with diet quality. We need data on what people are actually eating to start answering those questions. So the Global Diet Quality Project, and I'll put a link in the chat so you can read more about it on the website, but we've designed a questionnaire for monitoring that's meant to capture well-established constructs of what diet quality is, to be valid, collect valid data that's comparable, and to be feasible. Importantly, feasibility means, in this case, we're talking about a monitoring system, which is different than in-depth research, not, scaling up very expensive national quantitative dietary intake data, which is important for many reasons, but thinking about a light tool that can be used to take a pulse on what people are eating, how it's shifted during COVID, how it shifts during, price shifts and inflation, what is changing in diet patterns. We need a monitoring tool that's light and quick to be able to get indicators to monitor diet quality. And so this is a tool, the Diet Quality Questionnaire, that covers a number of food groups, 29 different food groups, which can be combined in ways to produce indicators that reflect two basic constructs. So many, what Ed had introduced is behind the design of the Diet Quality Questionnaire, the constructs essentially being adequacy and protection of health against non-communicable diseases. And on the adequacy side, looking at indicators of nutrient adequacy, as well as food group adequacy in terms of balanced diet and meeting dietary guidelines for food groups that should be consumed every day, said by many different countries. And then protection of health against NCDs, operationalized as indicators that meet the WHO dietary recommendations, firstly on pieces of diet that protect health against NCDs, very well established consensus on fruits, vegetables, whole grains, legumes, nuts, and seeds, fiber being protective of health, and then also having an indicator of the types of foods associated with risk factors for NCDs, such as excessive sugars, salts, fats, saturated fats, and red and processed meats. So the food groups captured by the questionnaire enable us to have indicators reflecting those constructs, and they have been adapted for every country in a very participatory effort, including almost up to now about 800 people around the world from 105 countries building these monitoring tools, so that the end result is a 5-minute questionnaire module, which can be administered by any survey, does not have to have nutrition expertise, can be slotted into country ongoing other efforts such as household consumption surveys, as a tool that can be readily scaled up globally through the Gallup World Poll and through other multi-country surveys such as the DHS. I'll also put another link to the tools so people can explore them on country level.
Great. Okay, thanks, Anna. That's really great, and it was good to hear a little bit about that specific fit for purposeness and the goal around global monitoring. I'd like to now switch to Javier and a very different, and I'm sorry if I'm mispronouncing. My many years in Latin America reflected there. That might not be the right pronunciation of your name, and apologies for that. But I'd like to switch to a very different use of the data, which I'm very interested to hear about. So the European Commission set dietary improvement targets for its farm to fork strategy, which is really fantastic to hear. Can you share with us what you are tracking that tracks progress towards those targets, how you're doing that tracking, how you're doing that, and how you're using that data to bring it back to the strategy and inform and reflect on that strategy going forward? Thanks.
Hello. Well, good afternoon and good morning for some participants, and thank you for the question. Just to come back to the strategy, because it's a part of what we call the Green Deal. The EU adopted in this context a global strategy covering food, named the Farm to Fork Strategy. It aims notably to accelerate the transition in the EU to a sustainable food system that should ensure food security, nutrition, and public health, ensuring that everyone has access to sufficient, safe, nutritious, sustainable food. I would say it's probably the main objective of this coalition. Indeed, this strategy provides that the Commission will monitor its implementation and progress. A part of this monitoring is to look at the shift to healthy, sustainable diets, for which the strategy, unfortunately, does not fix quantitative targets. So it means that we have to monitor, but on the other side, we have no quantitative target to reach. Well, monitoring and indicators are clearly a key element of this strategy, because they will help us just to ensure that it's working. Concretely, in this respect, the Commission developed is about to develop a new framework legislation on a EU sustainable food system, and in particular is developing a set of indicators to monitor progress of the strategy. It has been elaborated together with our internal scientific service, which is a joint research center, which will perform first a mapping of what is existing, then, if needed, elaborating some new indicators, which will be designed to complement the existing ones, and finally trying to elaborate a dashboard with all the indicators to monitor correctly the farm to fork strategy. Well, the timeline we have is, I should say, very optimistic. Normally, we hope to complete the work in 2023, but given the complexity of the exercise, the monitoring framework will probably be further refined after 2024. Because we know that there will some iterative work just to take into account new data we may have. Just to finish, we have the first deliverable of this strategy is what we call the Code of Conduct on Responsible Food Business and Marketing Practices. It has been launched in July 2021. It provides for 7 aspirational objectives, and it covers association and also individual private companies, so they can commit to a set of commitments. One of the objectives relates to the promotion of healthy, balanced, sustainable diets for all European consumers, which aims to reverse malnutrition and diet-related non-communicable disease in the EU, and also reduce the environmental footprint of food consumption. So it means that we have a set of objectives also, because you have many things. We hope to achieve those objectives, and we have an annual report on the progress of those commitments. A mapping study will provide insight on the type of commitment, and if needed, propose some additional action. And we hope to have a first report of the mapping study on this code of conduct by the end of 2022. So we will share it with the coalition, obviously, if we as soon as we have it. Thank you.
Thank you very much. I would like to go straight to Ed, so that we also have some time on the panel to field some of the questions that have been. I noticed there's a lively question and answer going on at the same time here. So Ed, we've now heard from the speakers on the panel, as well as our recorded message from Brazil. We've heard the experience of collecting and using dietary data that is being designed for a variety of different purposes and used for a variety of different purposes. How will you bring this rich experience back to the work that you're doing in relation to the components of a healthy diet that you shared with us during your presentation?
Well, I think a couple of points really caught my attention. There was a question in the question and answer. I posted an answer, but about what do we actually mean by patterns associated with positive health? And what I wrote there is, personally, that's a subconstruct that's been proposed that I'm kind of the least certain about. I think we need to really think through what that means. Does that refer to just sort of combinations of food that are healthy? But was also raised was, what about when you eat and patterns of timing and meals? And so I think there's some issues to be thought about there. I was I think that the work that Anna talked about, that she has led with others, is a really important initiative, and I think highlights sort of I don't know, the careful thinking that's required to try to figure out, how to do this in a way that gets information that we need. I think a question there that we need to think about, all of us need to think about, is okay, if we take an example of an instrument like that, what is it assessing and what is it not assessing, and is it getting the information? Clearly it's getting information we will use and that we need to have, but what is it not getting at? Are there gaps? Is there a type of information that we need in addition to that? So really bringing it back to the decisions that have to be made in countries, because, as Anna pointed out, there are, and Francesco talked about this at the beginning also, is that, there are different needs. So we need to think about, at a country level and global monitoring and SDGs and all of that. But if we want to help improve the diets of people in countries, and to have those diets be healthy for them, but also for the planet to be sustainable, then what information is needed to help countries make decisions and act? In that regard, both Jessica and Corinna talked about the need to, we've made tremendous progress in the last several years in really learning about and thinking about, particularly in Africa and Asia, because we had some information about this elsewhere, but really learning about the importance of understanding how and why people decide to eat what they're eating, but we don't have any way of sort of getting data about that, as they pointed out. And that's another issue that we really need to think through, is how would we do that, and what kind of information will really in the end be helpful. I think that Anna Solström in Sweden, talked about, and I'd love to find out how they're doing this, from having been involved in one effort to try to measure and have indicators of the food environment. It's a really difficult problem, and I think that it would be helpful to learn from them and others who are trying to do this. If we accept, as I agree we must, that it's not all on the individuals. Individuals are clearly shaped by the environment that they're in, and therefore we need to know something about those environments. So that's another challenge, to think about how do we assess that, and how do we do that within data systems that we have. That's a big challenge.
Thanks. That was really interesting, Ed. And I want to pick up on two questions that were posted and answered, but I think they're worthwhile to actually talk about them a little bit. So Ramani posted a question related to the management of potential interests when engaging with the private sector. And I think it's just worthwhile that you wrote a nice answer to that, Annika, but can you just talk a little bit about that? I think there's a lot of people concerned about that question and some varying opinions. I think it's really important to hear some experience specifically from Sweden in that regard.
Yeah, I think it's important to say that when we decide what areas we want to have goals around, what challenges we have, what are the biggest challenges regarding the food consumption in Sweden, and also what evidence do we have for the changes we need to do. That is purely based on science and independent from the private sector. But then we have to have them on board for them to understand that this is the challenges. And also when we phrase the goals and how we present them, if they are included in that process, they will also be more positive, I think, about the goals, and also if we can phrase them so it's easier for them to implement them in their work, we could be more successful in their work, So therefore, I think it's very important to have them on board, but they should not influence the limit we set and what areas we decide to have in the goals. They're also very good because they can provide us with data, sales data, for example, and also like why the food environment is like it is. I mean, they have a lot of knowledge of business, how the business works, that we don't know, that we need to have to understand the situation. So we have to have them on board, but we also have to have clear limits on where they can decide and what they can decide and influence. That's how we see it.
Thank you. Thank you. And may I pass that question over to you as well? And you really should correct my pronunciation. Is it Xavier? Would that be a more appropriate pronunciation? You can tell me that. And then just from the European Commission perspective, if you could comment on that same question related to private sector engagement.
Thank you, Lynette. Well, Xavier will be fine. Just to complete what my predecessor said, it's a necessity to work with the private sector. We have to be cautious because obviously their interest is not completely directly linked to what we are looking for. But we have to find the best way to establish a dialogue. Clearly, it's difficult, it's long, but it's the reason why I spoke earlier about this code of conduct. The code of conduct is a way to engage such a dialogue, to explain our objectives, and then to discuss on the difficulties for the private sector, on how to reach the objective we have set, why do we have set those objectives. So it's a way to initiate this dialogue, but it's clearly a very long dialogue, necessary one, but okay, we have to be cautious. So as Annika said, we have to be clear on our limit, on our red lines. But the private sector has also a lot of lessons to teach us, just to give some indication. And I would say it's impossible to go forward without taking into account private sector. But it's a dialogue to maintain.
Thanks very much. So I'd like to shift gears. Just one more question before we go to some final remarks. And I'm going to ask first Anna to respond to this and then Jessica. And I'm going to, Fatima, if you don't mind, I'm going to take the topic that you introduced in that question, but I'm going to change the question a little bit. So Fatima introduced the question of the collecting diet data for global monitoring using the diet quality instrument that you described, Anna, and whether we think that might create some tension of countries' willingness and ability to collect a more detailed data, a little bit more aligned with some of the things that you talked about, Jessica, on the dashboard, like that much more robust information, including sort of why people eat what they eat and so forth. And I think there is a tension there that it's important for us to think about when in countries with limited resources, limited time, how do we balance that tension between having the data that might be less detailed that is needed for global monitoring, but not at the cost of the more detailed data that might be needed for policymaking and programs. So I'd like to each to give a 1 minute each sort of response to that and how to manage that tension, I think, if you don't mind. Thanks.
Thanks. Yeah, I don't see it as a tension at all. I think that they are additive. I think that if we, my concern is the opposite, actually, of what how you put it. I'm concerned about the perfect being the enemy of the good. That if we fixate on having all the diet quality information that we would really want to have to answer many, many questions, that can come at the expense of basic information everywhere that can just get the conversation started. So I think we need both. I think we need monitoring data everywhere to simply raise this conversation about healthy diets and how it's related to the food system into the consciousness of many different people and sectors than who are here. We need to get diet quality on the map and have basic indicators that are easy to collect and easy to use in talking about the issue and providing evidence behind the issue widely. And then additionally, supplementing that kind of basic information with more detailed work. So I think that they're very complementary and both are needed, but to even get started to raise the issue of healthy diets and sustainable diets globally, we need to have monitoring systems. Thanks.
Jessica?
Yeah, I mean, I completely agree with Anna, and I think we do have to start somewhere, and that global data that that Anna and team are working on is the starting point for conversations that can happen in countries. But without having that basic data, it becomes difficult to even start the conversation about, okay, well, this is what people are eating in this country, and let's unpack that a bit. And that can be done in multiple ways. It doesn't have to be so systematized. It can be through country dialogues. It can be through community engagement. So I think Anna's setting forth the foundation for deeper conversations and a deeper exploration that countries can take to better understand why that data is the way it is. So to me, it's the starting point, and I agree that I don't think there's competition. I think it's opening doors more than anything else.
Okay, thanks very much. So we're going to end the panel. I'm going to, and unfortunately, I forgot to mention that Karina Hawks had to step off. She sends her apologies. But those who are remaining here, I would like you to each take 1 minute now and respond to coming back to our poll. So as a reminder, at the very beginning of the meeting, we asked the question, in your opinion, what is the single most important barrier to the collection of data on dietary intake and diet quality in the context where you work? And we gave responses that people had to respond to one only. The response options were a lack of funding, which was responded by 44% of the audience, a lack of technical capacity, 15%, lack of perceived need for the data, 7%, lack of clear guidance on how to do this, the collection and use and so forth, 30%, and 4% said that there were no major barriers in the context in which they worked. So quite a variety, a heavy emphasis on funding followed by technical guidance, but then still some across the other responses. So bearing that in mind, I would like you each to take a moment to answer the question. And this coming back to the group who has convened this, which is the Healthy Diet Coalition. What do you think the Healthy Diet Coalition can do to help overcome these barriers to the collection of use of data on healthy diets from sustainable food systems? So bringing it back to the coalition, what could the coalition do to overcome these barriers? I'll start with you, Jess.
Yeah, now I can't speak as a data, well, maybe a bit of a data user, and for particularly where it's needed most in countries, and so that's why it's great that we have people working in the different regions of countries in the group. I'm just going to argue for three things. I think countries, and this is my experience working on the dashboard and now the countdown. One is getting to subnational data. Food systems data is we need to unpack it. It's having national data, global data is fine, but for countries, the subnational is the key. And every group we meet with in countries argues for subnational data. And how do we better collect that and use that data to inform decision making? The second is what do people do with that data? How do they understand where they're at? What we call in the dashboard diagnosing, and Anna has a paper that's just been accepted in PLOS One, looking at some diagnostics of food systems. So how can people understand how their food systems are performing, not just what they look like, and then how do they take decisions? More how-tos on those things. How do you diagnose? How do you decide when you have this range of metrics to work with? And the third is and this is more for the research community, and so the UN hub maybe supporting researchers, data producers to get beyond these just off-the-shelf metrics that we have, a lot of FAO metrics, sorry, Lynette. How do we build in and better source information to advance the quantification of food systems and the impacts on diets? We need to move a bit beyond these off-the-shelf metrics that we have. We're finding that we're having issues with that in the countdown. So to researchers and data producers, we need to keep building some more sophisticated data that can show some of the food system interactions that metrics can bring about. So subnational data, diagnosing and deciding, using that data for that, and then getting beyond the off-the-shelf metrics that we currently have and getting a bit more sophisticated.
Okay, so bringing that to the coalition could help consolidate that request, what the requests are, could help bring the stories of how to decide and what is the experience of the countries, since the coalition has country members, could be consolidating some of that. How has it been decided? How is it being used? And then work with the academic members of the coalition and beyond to consolidate and promote some of that additional metrics development, shall we say. Okay, correct me if I have mischaracterized that in terms of, again, because we want to bring these comments back to what can the coalition do. Annika, over to you.
I support the idea of having subnational data. I think that's important. We can't just have global data or big regional data. I also think you could help us with finding good indicators covering socioeconomic differences, indicators for children, and also indicators for the food environment. And I think follow the progress in the countries and maybe name and shame a little bit. Thank you.
Great, thanks. Anna?
I think that this community is important to have begun after the Food Systems Summit, because it can be an opportunity to come together as not just a nutrition community, but specifically a community who understands and can advocate for the importance of healthy diets. And to do that successfully, we need to have really some concrete things that should happen about healthy diets. And I think that one of those concrete things should be that we need a global monitoring system for healthy diets. Without that, we will struggle to get it elevated on the agendas and then into country dialogues and into country subnational data collection to further understand. So, I would sort of refer back to how the food insecurity measurement has evolved with, Gallup has collected the food insecurity experience scale across countries since the last 7 years or so. And then it has now been adopted into country monitoring systems to enable subnational data and more dialogue at country level. And so I think there's like the global level and the country level that both come together to support information and then the use of that information. But we need to really strongly say that this is something that has to be monitored and that will elevate it into further conversations.
Okay,
Thanks.
Xavier?
Yes, thank you, Lynette. I think in addition to what has been said previously, we need also to lift diet quality up to the SDGs. I know that, well, also that the SDG aims to end all form of malnutrition, from stunting and wasting to obesity. So it means that I should say there is probably a lack of information on that, just because malnutrition is not so known. I would say that we are pushing now, discussing with BMZ, GIZ, and we are supporting FAO to have a clear indicator at the high level for SDG, so the minimum dietary diversity for women. So it means that beyond indicators at the country level, we need also indicators at the SDG level. I would say also that it's probably very difficult, but when we set indicators, we need to think about the evolution of the situation, because you have new layers adding to the problem of malnutrition, which are coming from the current pandemic, which are coming from the current instability on food security, which is coming from the climate change. So it means also that when we think about indicators, we have to think how all those external factors can influence malnutrition. And finally, just to add to what Anna said, probably the coalition should help to build on what is already existing. In particular, the Global Diet Quality Project. Well, the EU is funding it, is participating to the funding, and I think it's probably one of the best way to ensure having a monitoring tool in countries. Thank you.
Thanks, Ed.
Okay, so I wanted to go back to something that Anna Hertzforth and just said before, to the previous question you asked about the tension. And I agree with the argument that they made. There's a logic to the argument they made that having something out there helps bring attention to it. But the danger is real, and food insecurity that Anna brought up, which I know well, is a good example of that. Yes, it's fantastic that we have the FAO measure, but that measure only gets at certain aspects of food insecurity, certain sub-constructs of food insecurity, because its predecessors also did that. And so the danger is that we're, yes, measuring something about food insecurity, but we're not measuring everything that's important about food insecurity. So the danger is real that if we act too soon to put something out, that it will prevent really thinking through the whole issue. So I think two things are really important. One is that there's an effort underway led by FAO, WHO, and UNICEF in collaboration together to take a little bit of time in the next several months in particular to really think through what are the needs that are there, and what's the current state of measures and indicators that are available, and what is it that countries need, and to paint a picture for that, so that we make really good decisions going forward together, all of us. And the other thing is, Jess Fonso said this very well, and so I just want to reinforce it, that I think a place where this coalition could be extremely helpful is we really need to understand as best we can what is it that the countries do need to make decisions to improve the health and nutrition of their population. And to the extent to which the coalition, as it's done today by bringing together lots of people from countries, can help to capture what their needs are, that will be really important. Because in the end, the only reason we collect information like this is to help people make good decisions.
Thank you. That was a very, very rich panel. We've gone a little bit over our time, so I am going to go straight to introducing our person who will be closing the meeting, Brent Loken, who is the global food lead food scientist for the World Wildlife Fund. And we've had a rich discussion. I think we'll try to consolidate notes and come back. But for now, over to you, Brent, for some closing reflections. Thank you.
Thank you very much, Lynette. This has been a really fantastic discussion, and I'll keep my comments brief because I know that we are short of time. You know, the goal of this workshop was to provide this peer-to-peer experiences and to create this space where we could come together and talk about these things. And I think that we were able to do that today with the goal to eventually catalyze action. Some key takeaways that I heard today are the need to harmonize the many indicators that are out there. There are a lot of challenges in getting good and also robust data that we have to solve. The need to monitor progress with this global monitoring system is urgent. We have to start selecting indicators and coming to consensus on what these are. And there's a lot of data gaps out there that we have to start filling. And what is clear from this workshop is that a lot of us are facing many of the same issues. We're struggling with the same things, and that's a very positive thing. This is really good news. But the only way that we can solve this is for each one of us to come together to solve these challenges together. We can't do it individually. To start working together. This doesn't mean that we have to do the same thing, but we have to start working together. And this is one of the main goals of this coalition, is to provide the space where we can come together, we can discuss, we can share, and we can solve. This is not the end of this journey. This is only the beginning. This will take time, but I'm glad that we're working on this together. I would like to end with something that Anna said that I think is extremely important for us all to think about. Let's not let the perfect be the enemy of the good. And this is one of the issues with data, is that we tend to do that. We want to have the perfect data, and I don't think perfect data ever exists. We do have enough data in many or most places to get started, and getting started is absolutely urgent. So let's do that. We appreciate that each one of you have shared your time and experience with us. And we're very much looking forward to working with each one of you on this important journey together. Thank you very much.
Bye, everyone. Thank you so much for joining us.